and then the floor of that sinus into the frontal recess cells, we call it, and the anterior ethmoid are opacified compared to these that have nice black air with these little nice sharp septations. So I'm going to nibble up in there and remove this little swollen tissue, okay? In addition to ballooning that. But here you can see the septum is still bent, and so that'll be removed. And then for your turbinates, the inferior turbinates, I'd ask you if you had any trouble breathing. You feel like you breathe okay, correct?
During the day, yes.
Right.
At night,
Okay.
not, yeah.
At night, not. So I was going to out-fracture the turbinates, just move them out a little bit away from the septum. And I had a question mark whether I should try to burn them a little bit to shrink them down, and then I said I'd hold on that and we'll just leave it alone. You know, I don't want to do too much. You get some crust that develop, and since you're from Cayman, I don't want you to have a crust that stays in your nose and causes you trouble. So I'll just out-fracture that, and that, in addition to the septoplasty, should be enough to really help you with that. But that's basically what we see here, and you continue to have little bends of your septum. And so we're going to do that. Just a lot of abnormalities here. The septum's bent, the turbinates, the sinuses, and so all those things together, I think, are what's causing your problem. So we're going to address those today. Probably ought to take me maybe an hour and 15 minutes, something like that, to do it. And it will be under general anesthesia. You've got the anesthesia team, so they'll be responsible for that. And then afterward, we're not going to have any packing in the nose. And most patients say that, you know, they don't have any pain, it's more discomfort. So you'll have your pain pills to take, but most people use them for the first day or two and then go to Tylenol. You'll be here for the week, is that correct? Okay, wonderful, wonderful. And we'll see you back in a week, and we'll be checking in on you, but that's pretty much it. You know, you have some plumbing issues in your nose and your sinuses, and I'm going to take care of those and get you to feeling better. So that's the bottom line.
Great.
Is this a scar on your nose?
This is for the biopsy.
I see.
Yeah, the biopsy.
Okay.
Scar. Yeah.
Did you have any questions about anything, either of you?
No, not really.
Makes sense?
Yeah.
And you suffered from these headaches for how long?
Like 40 years.
40 years. And how did you find me?
I found you miraculously. I've researched migraines, every kind of migraines, dietary related.
Hold on just a second.
Yeah.